You know, even if you didn't have really crooked teeth as a young person, as we age, our teeth change. That's right. Even if they were straight at one time, they can move and become crooked. What does an adult do? Do they want a full mouth of metal braces? Do they want to just live with crooked teeth? There are many ways to dress up your mouth to get a beautiful smile, and that's why we consult with Incredible Smiles. A dentist, Dr. Lori Kemmet. She runs and owns Incredible Smiles, and I am a patient there, or as she puts it, a guest. I've been there for years, and she did cosmetic dentistry with me. She also does invisible braces, and we have Tim Kirkland with us. And Tim, you actually have them on right now, invisible braces right now.
I do.
Okay, now that's incredible, and I want you guys to look at him because he has it on now, and you can hardly tell at all. You'd have to get really, really close to notice something. And I want to ask Lori, first of all, Dr. Kemmet, when we talk about these invisible braces, I had some crooked teeth and I got fixed in 3 hours. I mean, so what's the difference between cosmetic dentistry and when would you recommend invisible braces?
It really depends on what the customer wants. Okay, so you wanted a quick fix. Let's go for a quick fix. You can put a veneer usually on a tooth that's crooked and make it look straight. Almost, well, it depends on
unless it's really, really bad.
Sometimes we have to straighten the teeth first in order to do the cosmetic dentistry.
Or to get the bite right? To
get the bite right. And in Tim's case, we had a tooth, and it would be great to show his picture, his before picture. We had a...
Do we have it?
We do have it.
Okay, let's look at this now. All right. So we have the before pictures, and talk about that.
Okay, so can you see the one tooth kind of on
yes.
the right-hand side? It's tucked behind
way
the
back.
bottom teeth.
Right.
And we talked to Tim about his options, and one of the options was let's take the tooth out and put an implant in there and get an immediate straight tooth.
Right.
And then we said, but there's another way, a conservative way of keeping your tooth and just moving it forward orthodontically, but not putting metal braces on. And Tim really didn't want metal braces. Tell them why, Tim.
Well, I'm a public speaker, and you know, as an adult, there's no way that I want to go out and look like a 13-year-old kid with a mouth full of metal. And this was an absolutely invisible way that I could do it. I can remove them to speak or for a business meeting, obviously to eat. They come in and out of my mouth.
They come in, I didn't know that.
Absolutely.
So you can take them in and out.
Yeah.
Oh, yeah.
And so how often do you have to wear them? How much during the day?
Ideally, 22 out of 24 hours a day.
But if someone has a quick appointment and doesn't want them on, they can take them off.
Absolutely.
Now that tooth that was back,
it's this one right here.
It's moved that much? How long have you had them on?
Just over a year.
See, that's a lot of movement for just under a year.
Yeah, incredible, isn't it? Yeah.
I'll be finished in a couple of weeks.
So the whole treatment took how long?
A little over a year for the top teeth. The bottom teeth he finished sooner. So he had some straightening to do on the bottom and major straightening to do on the top.
Well, will he even need any cosmetic dentistry?
Probably not. Maybe a little bit of whitening when we're finished.
A little bit of whitening, and you do that too?
Absolutely.
Now, people are asking, they always ask with orthodontics and everything, first of all, is financing available? How much is it? And we should really talk about how much. Because I'll tell you what, I look at this as an investment that won't go away. You can buy stuff, and believe me, I've done it, and the value goes, woo. But when she did my smile, every day people comment. Yep. So I did that 10 years ago about? Almost 8?
6.
No, it's longer than that. Guarantee you.
Oh my gosh.
Oh, yes, of course, longer than that.
Okay.
I can tell you because of the age of my kids. That was way before that. Now, all I want to say is, how much? Let's just get right out. How much is it?
It depends on the complication of it, but anywhere from $3,500 to $7,000.
But that is not expensive when you consider conventional orthodontics.
No, I mean, conventional orthodontics is going to be about the same.
Yeah.
Yeah.
And this is quicker, and this is an alternative for adults. It's quick, it's affordable, it's the same price you would pay if you went to an orthodontist, and you would have to wear metal, and you would have to have them clamped down and tightened up. Look at this, wait a minute.
This is somebody else now.
Wow.
Right.
This was done with invisible braces.
Yes, this is Chris, and about a 25-year-old man from Boulder, and he just wanted to have something, you know, done, and he came to us and was looking for solutions. His case took a little over a year as well.
Just a little over a year. And again, for the same price normal orthodontics would cost.
And that's Chris after.
See, and by the way, she's not showing pictures of some fictitious website. This is IncredibleSmiles.com.
We've got another picture too.
All right, let's see this one.
And this is Jamie from Fort Collins, and this is the before and after on Jamie.
And this is all done by you in your office?
Yes.
So they don't have to go anywhere else? No. And is financing available?
Yes, financing is available if you have good credit.
Yeah, of course.
Yes. Now, this is another example. This is actually...
is somebody wearing it
Somebody's wearing it in this picture. We wanted to show you what it looks like close up with it on. It looks like your teeth are shiny.
It does, it does. And you can take them out.
Absolutely. That's the advantage over the traditional braces. You can't take traditional braces out. Now,
do you recommend people take them out at night to clean their teeth and all of that, right?
Definitely. And take them out to eat, but otherwise they should be in.
Now, do they wear graduated invisible braces through the year or year and a half?
What do you mean by graduated?
Well, do you change them out to make
Every 2 weeks you change them, and they're different. Every 2 weeks they're putting pressure on the teeth in a different way. So every 2 weeks, every Monday, Tim switches his out.
Okay, and does he have them at home? Can he do it?
Yes.
Oh, that's a great system. So you don't have to go to get yanked on and to get wires tightened.
Right.
All right, I want to mention that you also do incredible cosmetic dentistry as well, full restoration. You do micro-thin veneers, I call them, because they are micro-thin, and you can never tell. And also digital x-rays. You have all of the newest technology, digital x-rays, ultrasonic cleanings, and what is laser therapy?
Laser therapy is, well, we use lasers for many different things. Two of the main things I use them for is tissue recontouring, just to make everything fall together and look good, because sometimes one tooth will look longer or shorter in the front, and by using the laser to raise the tissue, we can even things out. The other thing that we use lasers for is in hygiene. When you come in to get your teeth cleaned, if there's a pocket and we want to reduce that pocket, by using the laser we can actually stimulate, remove unhealthy tissue, but actually stimulate bone growth.
Really? So
yes.
You can actually help the mouth rebuild?
Yes.
And neuromuscular dentistry is something. She works with the mouth in order to get your bite proper. And why is that important for us with pain?
Well, a lot of people have TMJ symptoms, headaches.
Even migraines, right?
Migraines, and a lot of times it has a lot to do with the bite.
So you get the bite right, and sometimes all of the nerves relax, and people can have a pain-free, they don't have headaches anymore, their neck lightens up.
It's all about the muscles relax.
The neuromuscular dentistry.
Yep.
Now, all of this is available at one place, Incredible Smiles. Now, here it is, Incredible Smiles, and stay tuned because we told you about this orthodontic work. I'm going to tell you about an incredible deal, but right now, here's how you get in touch with them for a complimentary consultation. But remember, you get what you pay for when it comes to quality dental work. We're talking about an investment that will pay for years to come. 303-499-0013. 303-499-0013. If you're thinking about having these braces done, if you're thinking about having cosmetic dentistry done, then you want to call them and schedule an appointment so they can evaluate you. Or you can see some incredible before and after pictures at IncredibleSmiles.com. Now the special, I want to tell you, if you mentioned Martino TV, $500 off of the invisible braces if you schedule before the end, before January 31st, so she's extending it into the new year. $500 off in invisible braces if you schedule by January 31st. 303-499-0013, and as they say, operators are standing by. Well, just kidding. There's no operators up there. They're all just like a big family. In fact, it's like a dental spa. Did you know they do paraffin waxing? They do foot massages. I mean, I call it a dental spa. Paula?